I'm Dr. Martin Rutherford.
Dr. Randall Gates.
And today we're going to do the first in our No BS series on chronic pain. And today the first presentation that we're going to do is going to be on fibromyalgia.
And in today's broadcast, we're going to be discussing why so many of you have felt dejected seeing your doctors. We're going to discuss how a lot of doctors don't even want to see fibromyalgia patients. We will also go into the underlying causes of fibromyalgia, including childhood trauma and emotional trauma. We will also discuss how small fiber peripheral neuropathy has recently been discovered as a cause of fibromyalgia, as well as going into how the gastrointestinal tract is highly important for most fibro patients, including gluten reactions. And we'll finish up by discussing the thyroid. But before we get into all of that, I think it's important that most of you know that Dr. Rutherford is a fibromyalgia sufferer. And I think it'd be good, Doc, if you told the audience your story and how your fibromyalgia came to fruition, some of the obstacles you came up against, and misconceptions as well as stigma associated with your journey.
Okay. Well, and this is where the no BS part kind of comes in.
Mm-hmm.
You know, we're talking about now cutting through all of that, all of the things that Dr. Gates just got done talking to. And I wouldn't say I'm a big sufferer anymore, but I definitely was a sufferer at one point. So I mean, in the end, I have fibromyalgia, peripheral neuropathy, Hashimotos thyroiditis, gut problems. I specifically have celiac. I had fatigue, and yeah, I had all those things. And so as you're going to find out, Dr. Gates is going to expand on that quite a bit, because you're going to find a lot of consistency among those, as Dr. Gates just talked about. Fibromyalgia. For me, most people who come in here think that fibromyalgia starts at the time when you have the event. And for me, the event was I was under a tremendous amount of stress, going through a very stressful time. And at the same time, I got pneumonia. And I got pneumonia, and I was down for several weeks, and then suddenly I started developing symptoms. And the symptoms were tremendous fatigue. I started putting on weight. I started to, my hair started thinning out, and I started losing my eyebrows, and I started getting my bowel problems, which I already had for most of my life at a very low level, started getting really severe. Started getting numbness and tingling in my feet. Eventually I started getting like real sensitivity on my skin. And it was kind of difficult because it was confusing for me, because I'm waiting for me to come out of this pneumonia thing that was going on and on and on. I was coming back to work, I couldn't work. In fact, I would come to work for a half a day, and then I'd realize I couldn't be a whole day, I'd have to go home. And that whole thing really was difficult. I don't think my wife had ever really seen me sick. I'd never really missed days of work. And so, you know, I think she had some question about maybe if I was losing my sanity or something like that. Even though I wasn't feeling well, even though I was putting on weight, I would say on a daily basis, you know, I can't get out of bed. I'm so profoundly tired. My joints were starting to ache. And I'd have to stretch, and it'd take me literally sometimes a half an hour to get out of bed and get moving, to the point where I was able to come in and do my job, which was a very physical job at that point in time, and very energy draining. So I went to colleagues of mine. I'm here in Reno, Nevada. Reno, Nevada used to be the alternative Mecca center of literally the United States back in these times. Back in the 90s, because of the laws and what was allowed here. So I went to a number of my colleagues who were alternative medicine doctors. I went through, it's your thyroid, here take some thyroid supplements, it's your adrenals, here take some cortisol supplements. I went through, take this for your gut. I went through, you have heavy metals. I went through taking the mercury out of my mouth. I went through, it's chelation, a lot of things. No real diagnosis. It was just kind of like, nobody even said I had fibromyalgia at that point in time. It was kind of like, you know, well, you have this sickness, and we just have to keep doing this. And I have a little background in anatomy and biochemistry, human anatomy and biochemistry, before I got into doing musculoskeletal work. And so I was thinking, there's no organized game plan here, and these are good guys, and they're taking care of me, but this isn't it. So ultimately, I really had to kind of probe my own way, which we don't really need to get into that whole thing, but I did find some people who were able to help me. But along the way, I had people, like, what's wrong with you? And your personality has changed. And I think you need to go see like counseling or something. No one ever told me like psychiatrist or anything. And people, some people around me were kind of like, you just need to get up and you need to go to work and you need to do this. And I never said anything because I didn't really know what was going on. And I'm not one to go, well, I'm not going to go to work. So, and other than the fact that I started putting on weight, which sometimes I'm kind of a stocky guy, can maybe be hidden a little bit. Most of the fibromyalgia patients who come in here, as myself, who are in maybe on a scale of 0 to 10, maybe they're a 4 or 5 or a 6 or maybe even a 7 or less. You don't look sick. Once you start getting to be like a 7 or more, you start drooping down, your hair starts getting really thin, but you don't look sick. And that's really difficult. You don't look sick. People look at you. They're like, well, and you feel like your whole insides are falling apart, and people can't touch you. And there's days you can't put your pants. And then there's days you feel good, and then you go, whoa, I feel good. I'm going to go to work. I'm really going to bust it. And then, So I experienced all this, and ultimately, I don't know how far you want me to go with this, but those are the things that really were the highlights. Is there something and more specific I should?
I think that's good, and I think it's also important to note that you had Epstein Bar when you were.
Oh my goodness! When I was a kid. So do you want me to go back that far? Cool. So in the end, I did say most people come in here and they think it happened. They'll put down a date, June of like 4 years ago, and that's usually when the trigger happened. For me, it was an overwhelming infection and stress hormones. Mm-hmm. Okay, those were the big triggers, and the stress hormones probably were not just the trigger, but they were part of the whole thing, as you'll find out.
Which eventually led to thyroid dysfunction, which eventually led to a gluten diagnosis of celiac disease.
Yeah, and I didn't know if you wanted me to go into all that.
But I think that's important because you're a good case study, so to speak, for a lot of fibromyalgia patients to look at and understand. Because as I said in the bullet points, as we were talking about the agenda of today's talk, fibromyalgia can be caused by many different factors. It can be caused by irritable bowel syndrome, to small fiber peripheral neuropathy, to autoimmunity to the thyroid, all these different factors, stress, childhood trauma. And you as a fibromyalgia patient, you may have one of those 4 or 5 conditions I just mentioned. You may have all 5, you may have 2 or 3. Yeah. And so what we're trying to do is bring it all together today for you to really understand your condition, what's potentially causing it, so you get more understanding, because there's so much unnecessary confusion about fibromyalgia out there.
Okay, so I get it. So to take it back, I probably had this start when I was a kid. Okay, and I was born with a bad gut. I actually had to have what's called a pyloric stenosis. I had to have a surgery at 5 weeks old. What we now know is you have surgery, you probably end up having a permanent leaky gut. I grew up in a stress family. My dad had post-traumatic stress syndrome from fighting in World War II. We won't get into my mom, but my mom was pretty strict. So there was a lot of stress there. And by the time I was in 3rd or 4th grade, I had severe gut problems. And I even had a pass to go to the bathroom because my gut was bad, and I would have to have diarrhea, and I'd go and vomit and things of that nature. And what we're finding today is if a kid has those types of problems and they don't have pathological disease, they probably are in kind of a chronic stress cycle, or they have autoimmunity. In the end, I probably had both. Mom's Italian, okay? I'm eating and I pretty much a one income minimum wage family. So there were financial challenges there. I ate a lot of pasta, lots of pasta. My mother was the master of pasta, bread, pizza every other Friday night. That was our going out to dinner, and never realizing how much that was damaging me. Eventually, I got a diagnosis of celiac, okay? I look back and it was almost comical at this point in time. But the point that Dr. Gates is having me make, and I kind of alluded to it briefly, is that these things start way back. They're like dominoes that start back here, and then they come forward, and then they come forward. And I think the point that Dr. Gates wants me to illuminate the most is, I went through high school, would get stressed. Before I played sports, before I would go to play sports, I'd be like, I'd be like having diarrhea, and I'd be very nervous. And then at the age of 21, I believe, or 20, I got Epstein Bar Virus. Okay, I was overdoing it, and I got Epstein Bar Virus and strep throat, and that was the first time I noticed a change in my physiology. Up to that point in time, I was athletic. I played sports. I was very active. I could eat everything and never put on an ounce of weight, and at that point, that changed. So, and the other thing is, I was sick for almost 12 to 14 months, which I now understand that usually means that I probably developed an Epstein Bar Virus
reactivation and chronic infection.
And so for mono, you should be sick for 4, 5, or 6 weeks. I had to cancel my entire year of sports. I couldn't play. I had to start controlling my weight. I was putting on a little weight, and I think this is salient. I'm glad Dr. Gates brought me to this. I was putting on a little weight. All of a sudden, I had put on like 15 pounds, and I'm going like, all of a sudden I realized that my clothes were getting tight, and I was like, whoa, what is this? Like, okay, I'm 21, I must be getting old now. Not realizing that something changed in my physiology. I also started to not have quite the energy that I had at that point in time. And so it was subtle, okay? It was like I needed to sleep more. I needed to start kind of balancing out my life a little bit more. I needed to start pacing but it wasn't anything that stopped me from doing anything. And so I just looked at it as a natural evolution of life, which in retrospect now, I probably got an Epstein Bar Virus attack, probably hit my thyroid, changed my thyroid. You'll probably talk about Hashimotos.
Right, and then it was subtle for a number of years, so you went through a major stress.
And it was subtle from the time I was 21 until I was 48, I believe it was. And 48 is when the pneumonia and the stress response came together, and boom. And the next thing you know, it just blew up. And then
you had chronic fatigue, then you had pain all over your body. You were later found to have neuropathy.
So Dr. Gates knows this, because when he first came here, I had him evaluate me, and he's looking at me like, do I tell this guy how really bad how messed up he is? So that's why he knows so clearly what's going on. But yeah, in fact, yeah, I developed all of that.
So then all those dominoes fell apart.
So
and I think dominoes. It would be good.
Starting back there, boom, 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 boom.
And at this point, I think it'd be good if we went to your office and we talked about really the underlying brain factors as well as the physiology, going into a little more depth so that the fibromyalgia sufferer can really understand what's going on with their condition as these dominoes fall.
That's great, because I think when we say no BS, I think it'll come together a little bit as we walk through how we go through a fibromyalgia patient's history, and then what Dr. Gates just said, and you'll see how it all comes together. And then Dr. Gates will then he'll really be able to go through with you what fibromyalgia really is, and kind of clearing up a lot of the BS that's out there about fibromyalgia.
Right, we'll get into all the details, but now let's go into your office and let's talk about the physiology.
Let's do that.
Okay, so now we're in Dr. Rutherford's consultation room. Dr. Rutherford has done thousands of consultations with chronic pain patients. And by seeing thousands of patients, he's really had an ability to establish patterns that he sees with the fibromyalgia sufferers. Now, though I do treatment, this is your area. And so why don't you kind of go through what a lot of fibromyalgia sufferers come in with to your office?
Okay.
And kind of the explanations that you give them as to why they're suffering.
Okay. And Dr. Gates is right. I mean, I've been interested in chronic pain since 1987. Been interested in even more. I've been in practice since 1980. Been interested in even more since I got sick. So it's given me the opportunity to just listen over and over and over again. And as you hear these histories over and over again, in the beginning when I started doing this, I go, oh my God, how are you even going to figure out a fibromyalgia patient? I mean, they got chronic fatigue, they got peripheral neuropathy, they got 8 million different symptoms. But in the end, it's interesting. It comes down to a handful of major systems that started to pop out in these histories. So My job here is to do the evaluations initially, determine does that patient have the type of a condition that we can treat. We're talking about fibromyalgia today. And in the end, does that patient kind of maybe qualify? Do they have, I mean, are they going to be able to respond to the types of therapies that we do? I can kind of pick a lot of that up in the history. I can get a feel for where that patient embraces the concepts that we're talking about. We're talking about no BS today. That's kind of my job, is to come in here and cut through the BS and see how the patient reacts, and see if they cling to old ideas, they're going to sabotage what we're doing. Okay, so that's what I do. And in that vein, we've developed a very simple intake to accomplish that. And it's amazing at how you look at the intake and you can almost tell, like, at a glance as to what's going on after you've done, as you put, thousands and thousands and thousands of intakes. So let me walk through that with you, and what a fibromyalgia patient looks like when they come here. First, what they look like when they come in here is there's usually a patient sitting in front of me. And, you know, a lot of them are kind of like a little wary. They're kind of like, hey, you know, okay, here's like the 27th person I've been to who's going to tell me that it's in my head, or they're going to cure me, okay? I will tell you right now, nobody's going to cure you, because you're going to have an autoimmune problem, and Dr. Gates is going to illuminate on that later. But you can be like me, frankly. When I feel like really good, you can be like me. You can be like 95% better. You can be functional, but have the tools necessary. You're going to have to change your lifestyle and have the tools necessary to stay better. And so people are coming in here trying to figure out, like, what's going on. Does this gentleman know? Do these doctors know? And can he, or am I a candidate? You know, so there's a little tension there, and I'm trying to figure out, okay, is this person have a problem that we can help with the types of things that we do? Are they a candidate? We do have people that we cannot help, and I think you need to know that there are people we cannot help. So that's why we take so much care to screen you, because we understand what the BS is out there on fibromyalgia. We've cut through it, and we can get to the point here. And here's the point. The history, as we just started with my case, usually does not start 3 years ago when you happen. And when a person puts that down, I always have to gingerly kind of lead them back to the beginning, and the patient usually always gets it, ultimately. Okay, but there's usually a trigger date. Usually there's a trigger, and the trigger is it was July 4th, 1998, and it was July 4th weekend, and you know, there was some guy who was drinking too much, and he hit me from behind, or it's usually like I had a baby that day, or I had a surgery that day. There are a number of triggers which Dr. Gates and I may discuss later on, and then the person has that perception that that's the beginning. Okay. Usually that person's already a compromised host, and in the way that we go through this, we have to bring them back, and ultimately we're going to talk probably prominently about emotional trauma, childhood trauma, those types of things that Dr. Gates is going to talk about later. So we kind of walk through that by looking at their history. First thing I look at is, actually, and some of these things are going to seem silly to you, but they're not. First thing I look at is the person's height and weight. If the person's got fibromyalgia, they're overweight, it's going to tell me maybe they got a bad gut. It's going to tell me maybe they got stress hormones. It's going to tell, but it's really going to tell me maybe they got a thyroid problem. I look through to see if they're divorced and when, okay? Because divorce can be a little stressful. And I'm going through these things because you're going to hear them echoed in Dr. Gates's very thorough presentation on what the main pieces of fibromyalgia are. And so, you know, I look to see, are they doing well? Did they just begin? Are they in it? Are they really, like, ready? Have they, like, been everywhere, tried everything, hit the wall, done every diet that's out there, done every supplement that's out there, had their teeth taken out, gone and taken, like, you know, it's the parasites, it's the candy. That's the best patient, because all of that has already failed. And so that helps me to understand that not only is that patient maybe ready, but that they're going to understand what I say, because they've already been through all that. I will then look at their allergies. If people have a ton of allergies, or if they have specific allergies to gluten or wheat, that gives me a hint that they might have certain things like food sensitivities, maybe autoimmunities. I look at their drugs, because I had a lady come in here yesterday, sweet gal. She's in here, she's got all of these problems from fibromyalgia, but she doesn't mark nothing down here. but she puts all of her drugs. Well, you can kind of tell what's going on with the person from their drugs. Do they have high blood pressure? Do they have a bad gut? Their supplement. Are they taking probiotics? Are they on vitamin D? If you're on vitamin D and your vitamin D is in the toilet, guess what? It's probably because you have an autoimmune problem. It's probably not because you haven't been out in the sun enough, okay? So these are things you can really, really tell by listening to the person's history. And you can start to create an idea, especially if you have an understanding of what fibromyalgia is already, you can start to create an idea of, okay, is this patient in our ballpark? And do they actually have fibromyalgia? People come in here, and fibromyalgia, as you're going to cover later, can still be a diagnosis of exclusion. And so do you really have fibromyalgia, or do you have something else that we can or can't treat, okay? Surgeries. Somebody comes in here and their gallbladder's out, their appendix is out, their uterus is out, their tonsils are out. I'm going to have to look any further. I know that they have an autoimmune problem. These are clinical pearls gleaned from thousands of histories that we've done. And let me just say, Dr. Gates has been here for 8 years, and he's been doing all of the exams, not just the histories, but comparing the histories to your exam findings and to the results that we've gotten from a lot of trial and error. We're not trial and error phase anymore, but we were, okay? It really comes from all of that. And so if you have like 4 organs out, and several of them have to do with your immune system, like your tonsils because they had to come out, or your appendix because they were inflamed, or your uterus because you had endometriosis, which, by the way, is an autoimmune problem. You're building our understanding that you probably have an autoimmune problem. Again, you're going to see why that's important in a few minutes. And then we have this little section where people check off boxes. Here's what the fibromyalgia patient checks. Usually it's most, if not all of these, but it's somewhere in here. And here's how it goes. And this is the order in which I even look at it. Thyroid problems, yes. Sometimes today, sometimes people will actually write down Hashimotos.
Okay.
All right. 5 years ago,
right, that wasn't happening.
Nobody wrote down Hashimotos. And then I'd have to go through that whole thing of like, yes, there is such thing as Hashimotos. Yes, or there's a book up here from my mentor, Why Do I Still Have Thyroid Symptoms, or my lab tests are normal. Okay. But a lot of you are familiar with that today. Hashimotos, you're going to find out why I mentioned that. So thyroid, yes, they have it marked down. Most depression, yes, they have it marked down. Some diabetes, I write that down because most of you do not have diabetes. That leads me to ask them about insulin resistance. They get tired after you eat a big meal, etc. You'll see why that's important. Digestive bowel problems, everybody puts that down. Doesn't have to be celiac like I have. It could be irritable bowel syndrome. It could be anything, frankly, okay? It could be having a surgery like I had when you were 5 weeks old, or a surgery or a bypass or things of that nature. But digestive bowel, big deal. Dizziness and vertigo. Most of you write that down. And the point is, a lot of you aren't connecting the dots here, okay? And like Dr. Gates brought out in me when we did the initial, these are like dominoes. This problem started back when you were a kid. Whether it started with your gut, whether it started with stress responses, whether it started with an autoimmunity, whether it started with like zillions of rounds of antibiotics destroying your gut. It started back there, the dominoes start falling, and you don't always connect the dots. But in the end, what we find out here is everything's connected. Virtually every chronic condition you have from the time you're a kid until you get here, we're connected. And then we have a fibromyalgia box. You want to know something? 80% of people walk in here with fibromyalgia don't check that box. So because they've either been diagnosed and just like go like, well, they told me it's a diagnosis. I don't know what's wrong. Maybe I have fibromyalgia. Maybe I don't have fibromyalgia. So at this point, I'll usually tell them what fibromyalgia is. Dr. Gates is going to do that as soon as I'm done with this. And then high blood pressure, some people mark it down, some people don't. But if you have high blood pressure, it's significant. Because if you have high blood pressure, it's not your heart, it's not corroded arteries, it's not your kidneys. You're going to have the main problem that Dr. Gates is going to share with you that has created the pain that causes your fibromyalgia. And chronic fatigue, that's a big one. All right, because if you recall, maybe you know the history of it or not, Dr. Gates is going to go over it. Chronic fatigue and fibromyalgia were linked like this in the 90s. There's a reason for it. They both have the same causes, okay? And so chronic fatigue, cold hands and feet, because you have a thyroid problem or because you have stress hormones. And a lot of people mark down asthma. That I'm going to go over that briefly. And a lot of people mark down arthritis. A lot of people because they have joint pain, but I'll ask them, is it rheumatoid? Well, no, I just got joint pain, and then the tests were normal, but they diagnosed me with arthritis. And then urinary tract infections, low libido, brain fog, really common. Short-term memory loss, extremely common. Now, who's that sound like? If you're watching this and you have fibromyalgia, it sounds like you. Okay, so this is and this is part of the no BS thing. I mean, most people are going to like at least 5 or 6 or 7 different doctors for these things. Yeah.
That's a really good point, because you mentioned that there's kind of one or a couple underlying causes to all of this, whereas most of you are seeing a doctor for each one of these conditions. It may not be that egregious of an example, but truly we have a lot of patients who come in seeing seven specialists for all these problems.
Look, the average fibro patient comes in here on between 5 and 15 medications. Now, I'm going to have Dr. Gates correct me on this, because this is just a take. We're just doing this, okay? We haven't rehearsed this or anything like that. Here's the deal. Is it not true that more than 3 major drugs is considered polypharmacy?
I believe so, yeah.
Okay, and polypharmacy is what?
Taking too many medications.
Yeah. Average I've had people take more than 15 drugs, and they're mostly going to at least a multiple number of doctors to be taking all of those different drugs. Most of all, one of them doesn't know which ones the other one's giving you. They're not talking to each other, stuff like that. And if you're a fibromyalgia patient, I went through this, you're going through this. I didn't go through as much as you because I was a little resistant to a lot of drugs. I do take a medication now. I do take a thyroid medication, but other than that, that's it. And trust me, I've had everything that you've had probably except polycystic ovarian syndrome. So that was a joke. So
I think that a really important point that the fibromyalgia sufferer get is the importance of stress hormones. So as we talked about in the introduction, I'm going to go through each one of the main components of fibromyalgia in detail. But Dr. Rutherford really has a great understanding of how the stress hormones affect physiology, and his explanation of that, I think, is quite profound. And I think it would be really important for a lot of you to understand this, because as many of you will tell us, I'm not stressed, and it's different from that. So maybe you can elaborate on that, Doc.
And it's so true. We don't even put it down. We don't even put stress down on our intake, because there's a couple of things that people just don't want to concede. And one is that they're stressed or that they can't handle stress. And frankly, it's not what we're talking about. I'll see a couple of things in here. Maybe they're taking Prozac, or maybe they're taking some sort of a Xanax or something like that. Or maybe I look down here and they can't sleep, and I'll say, well, you have difficulty falling asleep, you have difficulty waking up. There's some neurological things that you can see when a patient is actually sitting there that I know that their brain is going a million miles an hour and it's flooding their system with stress hormones. So usually what I'll do is gently summarize what Dr. Gates is going to tell you here in a few minutes as to what fibromyalgia is. And our paradigm is I don't know if I say it's different. It is different, but our paradigm is more targeted. I didn't give my credentials in the beginning. I was probably one of the first certified functional medicine practitioners in the country a long time ago. I studied with the gentleman who was developing these things a long time ago. And I'm a little bit hesitant to I didn't mention sort of functional medicine in the beginning, because functional medicine is fine. But for fibromyalgia, functional medicine is kind of like a lot of times you'll get too many supplements, too many drugs, too many procedures. This is where maybe you're doing the chelation, and maybe it's a parasite, and maybe it's this, and maybe you did all the diets and it didn't work, and so these things play into the fact that a person needs to be a little bit more targeted. So I'll go through our paradigm with them. I'll go through what you're going to go through. And there's like 4 major players to fibromyalgia, and I always go over the main one, which you're going to find out to be the stress response last, because it's sensitive. So after I've gone through this, and I'm absolutely certain that the person sitting in front of me is experiencing the stress response, I'll just let them know. I'll just say, look, you have signs that this stress response might be going on. And you need to understand how important this is. So let me walk through this with you. And here's what we're talking about. This is a major, 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 major key to what is your problem. If you go back to what I talked about in the beginning of when I shared my story with you, pneumonia was the trigger, but I was under a tremendous amount of stress at the time for years. That was just wearing on me. And I thought I was handling it well, by the way, okay? I wasn't stressed. I was taking good care of it. And I'm saying that because that's what I hear from a lot of you all the time, because you've already been told to pull up your bootstraps. You've already been told you need to see a counselor. You've already been told that. Well, it's not that. In fact, technically, you're not even stressed, as you're going to find out here in a second. And technically, your stress response that you need to go see a counselor for is not a personality disorder. It's not a weakness. It's not a mental weakness. It's this. And here's what this is, okay? This is your brain, okay? Over here, you want to move your arm. You want to move your right arm. There's the left side of your brain. Or let's go to the right side of your brain. You want to move your left arm. This guy tells you to do that. You want to talk. There's a part of your brain that helps you to talk. This is the part of the brain that's the thinking brain. I think I do. I think I get an idea. But this is the part of the brain that controls everything else, okay? So this is the brain stem, all right? There's 3 parts to it. The bottom 2 parts keep you calm, okay? These 2 parts of the brain keep you calm. For those of you who've heard of the term parasympathetic nervous system, this is where it resides, all right? When this is working, life is good. In absence of pathology, in absence of cancer, in absence of tumors in your gut, in absence of problems with your kidney or your heart, in absence of that, when this is working well, you sleep well. You don't tell me I wake up, I can't go back to sleep and stuff like that, okay? Your heart beats well. Your blood pressure is good. You digest well. Your saliva works well. Your tears work well. Everything works well because you are designed to be in a state of relaxation. Yeah, that's our normal state. And so, when this is working well, that's how you are. Now, we have a mechanism that is built into our brain and our neurology that is a good mechanism. It's a survival mechanism, and that survival mechanism is your fight-flight syndrome, okay? I think that's what most people are aware of it being called, okay? We call it sympathetic dominance, sympathetic wind-up. We have a number of words for it, and I'll explain those in a second. So when you perceive danger, okay, you're walking down the street, it's late at night, somebody's crossing the street, it's like dark, and they're like twice your size, and maybe they got a hat pulled down over your eyes so you can't see what their eyes look like. Your brain immediately goes, this is not good. At least my brain would go, this is not good, because I'm just a little guy. Okay, so they come walking at you. Immediately, there's a part of your brain that perceives danger. It's this part right here that you see I've poked about 1 million times. This part of your brain is the fear center of your brain. It happens to be very engaged in your entire emotional system, but this is the fear. The thing you need to know is this is the fear center of your brain. Fear center gets set off. Okay, even if it's a loud noise and you go like this can be a very, very rapid response. But let's stick to the guy walking across the street. So this gets set off. Now, it tells the upper third of your brain, which we haven't talked about yet, there's danger, and it sends a signal here, and it sets off the upper third of your brain, which speeds things up. Bottom part slows things down. Upper part speeds things up. That's called your sympathetic nervous system, okay? Thus we call it sympathetic dominance. Because the sympathetic speeding up part of your brain dominates the parasympathetic slowing down part of your brain. It then sends a signal down your spinal cord out to the infamous adrenal glands, which many of you have been told are the problem. This is part of the no BS part. I've written a couple of articles on it. We've written a couple of articles on this, on the adrenals are the wrong target. I think they should call your adrenal glands the balance glands, the homeostasis glands. They control your blood sugar, they control your electrolytes, they help to control your blood pressure, and they send out stress hormones. Okay, and when this occurs, all of that happens rapidly. And so what happens is it sends out these stress hormones, your electrolytes you send blood sugar into your blood, you send out adrenaline, heart starts pumping, you send out epinephrine, so now your bronchioles start, so now you're breathing, your heart's pounding, so you're sucking in tons of oxygen. You're getting blood sugar pushed from your liver into your arteries, because that's what your adrenals are doing. They work with you. They put out something called glucocorticoids, and that gets blood sugar out of your liver and into your arteries. And now your blood pressure goes up, and you're pushing all that stuff into your cells, your brain. Now you're stronger. You can run faster. You can jump higher. You can fight better. Even your senses become more acute, so that you're in a position to be like, mutant ninja, I'm gonna beat this guy up, or a track star and run the other way, okay? So then what happens is the guy walks past you, and you see him putting his key in his car, and you go, and what happens there is mainly, as I understand it, there's a part of your brain that tells your frontal lobe, and your frontal lobe is like the big guy here. Okay, this is the important part. This frontal lobe is supposed to shut this amygdala, this fear center, down, and it does. And then all of that stuff in your adrenal gland stops getting signals, and everything goes down, and you go on your way. So that's not what's happening. That's what's happening to you. That is what's happening to you. But in you, there's a significant difference. This mechanism is a survival mechanism, and is a good mechanism when it's engaged for minutes, maybe 10, 20 minutes, not much more than that. There are people who maybe 30 minutes or something like that, or a couple of hours, but not much more than that. Now, Dr. Gates is going to talk to you about this in a few minutes. When a person develops emotional trauma, it could be that you have a dad who had post-traumatic stress syndrome from fighting with General Patton, like I had. It could be somebody who, it could be a difficult relationship with your parents when you're a child. It could be that you were, and when I say this to a patient, I usually don't look at them, because I don't want them to be uncomfortable. I'll usually look down and say it could be physical, verbal, sexual abuse, because those are very sensitive things. It could be and it happens more often than not in the fibromyalgia patients. That is what is priming this amygdala. It could be that you had a severe divorce. It could be, I had one person sit here and said, I in one day, you haven't seen this person yet, in one day, she saw somebody got shot, and she had somebody point a gun at her and not have it go off. That's emotional trauma. Or it could be perfectionism. Mm-hmm. Okay? So these are things to know, because these emotional events engaged the fear center. But these emotional traumas, for some reason, which Dr. Gates might explain to you in more detail later, they literally program this. So that even though the emotional trauma is when you were 3 years old, and we've had people who come in here, I was sexually abused from the time I was 4 until I was 8. Even though emotional trauma is 35 years ago, it's still here. And then this whole thing keeps going. And when this keeps going, this is a problem. It's not just that you're always stressed. Here's what it is. Those stress hormones from the adrenal glands, first thing they do is go back and sabotage the frontal lobe so that it can't shut this down. And it's a big part, not all, but a big part of the reason you have depression. Yeah, I realize you're going through a lot, but in our world, depression is a bad frontal lobe. And this is a big part of what makes your frontal lobe bad, by bombarding it with stress hormones. Then it attacks something called your hippocampus, a little thing, not coincidentally, it sits right next to your fear center. And that creates short-term memory loss. It also creates the condition in which I can't go to sleep, I wake up, I can't go back to sleep, because it controls your circadian rhythm, because short-term memory loss turns into long-term memory when you're sleeping, so they're both in the same hippocampus, and then that contributes to brain fog, among other things that Dr. Gates is going to discuss. It can create immune inflammation when you have that many stress hormones going for that long a period of time, and it's one of the causes of what Dr. Gates is going to talk about later relative to your thyroid. It can create chronic infections of your cavities, your sinus cavity, your lung cavity, and your intestinal cavity. So the lady was sitting here yesterday, oh my God, I mean, I've had chronic sinus infections my whole life and they can't find out what it is. The people who check asthma off, the people who check off sometimes even different types of bronchitis, but mostly like asthma and things of that nature, what happens is they will, this is a part of that, okay? And a lot of times it'll calm down when you calm down that inflammation. It affects the gut. And the gut, it totally damages the gut. In the short term, when you're in fight, flight, and it's not this chronic thing, your gut is shut down, your bladder shut down, and your adrenal glands shunt chemicals into making stress hormones that should be making your estrogen. So in the long term, okay, and so in the short term, it's taking all that stuff and it's pushing it everywhere else so you can be strong, because you don't need to be pooping or peeing or thinking about sex when you're fighting or fleeing. But in the long term, your gut gets damaged. Decreased blood supply to your gut, decreased vagal response, which is the nerve that controls your bowel movements. Oh, I have constipation. And even to back up on that, these stress hormones cause your stomach to not make hydrochloric acid, which doesn't allow you to make the enzymes that digest your food. You can't digest your food. You can't kill bacteria. You can't kill viruses that are supposed to be going into your intestines. You're not digesting your food. The lack of hydrochloric acid tells your pancreas not to work, tells your gallbladder not to work. No BS series. You come in here taking hydrochloric acid, pancreatic enzymes, and bile salts for your gallbladder, and you're ecstatic because part of your symptoms are better. But what is that fixing? Nothing. Because this, and you're going to find out other things, are causing that. Then all of that slows your gut down. You're now getting stress hormones that are actually attacking the inside of your gut. And now you have the now better known and more accepted leaky gut, which I prefer the term intestinal permeability, but we'll go with leaky gut. And then that creates food sensitivities. And between the stress response and other things, you get constipation. Ultimately, depending on certain things, you can create different imbalances of bacteria. You can get small intestinal bacterial overgrowth. You can get gas. You can get diarrhea. Next thing you know, you got irritable bowel syndrome because nobody knows what it is. And so on and so on and so forth. You can get chronic urinary tract infections from this, because if your bladder is shutting down and it thinks you're continually in fight flight because of this amygdala, your bladder is confused as to whether to stop, as to whether to should I let them urinate or should I not let them urinate. You get little drips in there. It becomes a petri dish. The urine becomes a petri dish, like a petri dish. It gets infected. You get antibiotics, and the antibiotics do what? Screw up your gut that's already screwed up. This is like the cycle here, and it's really crazy. And then you get the low libido, because the stress hormones, I think this is a good point, the stress hormones are being made out of the same chemicals in your adrenal gland that are making your estrogen and your testosterone. And when your estrogen levels start getting off, if you come in here and you say, I have female problems, I have too much bleeding, too little bleeding, too long a period, I have too short a period, it's cramping, just about anything you can imagine. If you don't have endometriosis, if you don't have polycystic ovarian syndrome or something like that, or cancer that's causing that, or problem with your pituitary gland, it's the stress mechanism that is causing that. And so you're off to the no BS here. Now you're off to the hormone replacement therapy group, okay? When the problem is here, and one or two other things that are causing that to be an issue. And I could go on for even longer than this, okay? But the reality is, this is just one of the 4 areas that Dr. Gates is going to talk about in his presentation here in a few minutes, and his discussing what fibromyalgia actually is. But we believe, and I don't, it's not a belief to us, okay? I mean, our position is this is the key. This is not just the key to getting better. This is not just the key to staying better, but this is probably what desynchronized the entire system to create the other things that you're going to talk about that ultimately resulted in your truly having a diagnosis of fibromyalgia, which you're about to find out what that entails.
Mm-hmm. I think that's a great explanation. Yeah, it's a great way to open it up. And truly that was perfect, because you as the fibromyalgia patient out there need to understand everything Dr. Rutherford just said. If you need to go back and watch what he said again, I highly recommend it, because this stress mechanism, this fight-flight response is a better way to term it, is the thing that is destabilizing so many fibromyalgia patients. It's the underlying cause. In a few minutes, we'll talk about other factors as to why this fight-flight response just keeps going uninhibited, kind of like without the brake pedal there. But with this is why so many of you are running from medical doctor to medical doctor, from alternative specialist to alternative specialist, like you said, with bioidentical hormones, on and on and on, taking supplements, taking this, taking bile acid, because no one's addressing this underlying factor.
And this is you know, and I got to say this, and this wasn't planned or anything like this, but this is like a new paradigm, and patients who come in here are starting to get it. First, there was the functional medicine paradigm; it was all the brain. There was the functional neurology paradigm that was all the brain. Then there was the functional medicine protocol that it was Hashimoto's thyroiditis and gut. And then there was functional medicine. Here, take 2 bags of supplements and go on the paleo diet. This is more, you know, and maybe it's a little harsh to call it BS, but the reality is functional medicine has become a little bit commercialized. I grew up in functional medicine, okay, and truly, it disappoints me that now it's basically it's kind of like boilerplate. It's like, come in, it's the paleo diet, it's the FODMAP diet, it's the SIBO diet, and here's the test that Dr. Krasnian put together years and years. Here's the blood test, and we're going to give you a supplement for every single one of those blood tests, and we're going to give you adrenal supplements for this chronic fight-flight syndrome. Well, you're probably going to repeat this later, but that's kind of like peeing on a forest fire.
Right, exactly. And so the idea is, and we've done this, that's why we can say it from experience. We did a whole period of time where we weren't addressing the brain. We addressed the brain first, then we had a period where we were just addressing a lot of these problems with functional medicine. And what we found is that these problems were not resolving in the long term because we were missing the stress response, like Dr. Rutherford is talking about. The stress response is the holy grail of so many chronic pain, chronic fatigue conditions. There are exceptions, but for the most part, this is a factor that we've seen to be the underlying unifying factor as to why so many of you are not getting better.
Yeah, so what we're going to do now is we're going to go to Dr. Gates. Dr. Gates is going to go over this with you, but people are starting to understand who come in here, and people who are pretty prominent in their areas of expertise in the healthcare world are starting to recognize this paradigm. Now, we don't have a name for it, and we're not going to call it the Power Health Miracle Get Better and Stay Better paradigm. That's not what we're looking for. We're looking for you to, look, we've been there. I've been sick, okay, we've been there. We just want you to be better, and Dr. Gates is now going to present to you the main keys to what is fibromyalgia, how you diagnose fibromyalgia, how you know what it is for sure, and how you help that patient to ultimately improve to the point where they are on most days feeling pretty darn good, and on other days still having symptoms, because there's no cure for this, because you're going to find out there's an autoimmunity in there, and you're going to find out that on those bad days, you're going to know why you felt bad and what to do, and you'll have the tools to control it, but only if you understand what Dr. Gates is about to go over with you, and if you really embrace this, and if you really understand that these are the things that need to be developed. And it'll make your life a lot simpler, because you'll be empowered, and you won't and you'll know that there aren't as many moving parts as you think there are. Our motto, our mantra here is less is more. Less supplements are more. Unfortunately, less exercise is more. And Dr. Gates is going to go over the nuts and bolts as to why all of that is not theory. Nothing that he's going to go over with you over the next 10 or 15 or 20 minutes is going to be theory, and you can go to our website. Frankly, we have about 400 hours online, and if any of these things interest you specifically, you can refer to those. And Dr. Gates is the research nut of the world. That's all he does. Okay, he's no life, he researches. Okay, and so each one of those presentations online have anywhere from 15 to, I think the one on leaky gut has like 110 or 120 peer-reviewed journal references attached, so that if you're of that mindset, you'll know we're not making this stuff up. It's in the literature, and we have gleaned it from thousands of patients that we have worked with on trial and error, and our current results are consistently successful in the properly selected patients. So I know this has gone a little bit long, but please stay tuned, because you are about to find out what's really wrong with you.
Okay, all right.
So now you're somewhat familiar with the different parts of what fibromyalgia may be. And we talked about them a little obliquely when we were just going through what a consult looks like with the patient. So let's get a lot more specific now, because in our world, fibromyalgia has a very precise, very specific diagnostic meaning. And there's a handful of moving parts that are there in virtually every fibromyalgia patient. And Dr. Gates would like the fibromyalgia patient watching us to really understand the full breadth and complexity of what fibromyalgia is all about. And to do so, we're going to have to kind of go back a little bit through the history if we want to really understand the suffering of the fibromyalgia patient. And some of the suffering comes with just not being understood, having years and years and years of people telling you that, well, we really don't know that you have it. We don't know that it really exists. I just heard literally 2 days ago from a very educated person who came in here with fibromyalgia, who said, up until now, I thought that this was a fake disease. She said, but now I think I have it. Wow. And so now we're going to get into that, and we're going to get into the specific physiological and neurological aspects of what's causing your chronic pain. So understanding the suffering.
Understanding the suffering goes back to, the 1980s when fibromyalgia first started gaining traction. Researchers started looking into how could someone like you be experiencing so much pain. They started doing muscle biopsies, trying to figure out, was there something actually wrong in the muscle fibers? That's what it's named after. Fibromyalgia means pain in the muscle fibers. And they determined that really there's nothing wrong in your muscles. And so from there, some of the research, especially into the early 2000s, was looking at a component called central sensitization. What that really means is that your pain nerves, all of us have pain signals coming into our brain, but our brain drowns out those pain signals. But what they were finding with fibromyalgia patients is that their brain, or your brain, is not drowning out the pain signals coming from your body. So that was kind of one of the first big revelations. And then another major revelation was the association between stress responses and that central sensitization. So then they started looking further into how elevated levels of stress or trauma could influence how much adrenaline your body is producing, how much cortisol your body is producing, and with that, making you more sensitive to pain. The research then further went into how the brain starts to learn pain when it's chronically receiving these pain signals at too high of a rate. Then we began to find out how insomnia, which many of you have, really negatively affects your brainstem's ability to shut off pain signals coming from your body. And then we're going to go through also autoimmune thyroid disease in detail, gut reactions to certain foods, and irritable bowel syndrome, as well as neuropathy. So that's kind of the template for understanding your pain as a fibromyalgia sufferer.
Okay, and we're going to hit that more specifically. One of the frustrations that I found, and I hear it almost a couple of times a week here when I'm doing interviews, is that frustration of, I don't know that the doctor really believes me. The doctor says all my tests are normal. The doctor says I need to maybe go through some counseling. Why can't I just be happy? Why can't you just like pull up your bootstraps like everybody else does? And assume that part of it is because a lot of us, at least in the middle or early to mid stages, don't look all that sick. But apparently there's more to it. And there's actually data out there on this. So maybe it would make the fibromyalgia world patients feel a little bit better to know, maybe it won't make them feel a little bit better to know why doctors really don't want to treat them, why rheumatologists particularly don't really want to treat them.
Yeah, that's a very, very interesting topic. It's emotional for a lot of fibromyalgia patients for them to really understand this. There's a great article. I tend to be a little pedantic because we attach a lot of articles to what we do, because a lot of you have been told there's nothing wrong with you, like Dr. Rutherford is saying. And so we put these articles there to show you that the proof is in the pudding. The proof is there. All this is so well researched. And there's this article by an author, White, about fibromyalgia. And he said, few conditions evoke such ire as fibromyalgia. So really what that means is that this condition evokes a lot of anger for a lot of physicians. And it was also said that though a lot of doctors won't specifically write this because they don't want their name attached to it, in closed circles and private meeting rooms, most physicians and healthcare practitioners think that fibromyalgia is basically a non-condition, it's a non-disease. You are making it up, you're faking it. Basically, you just have emotional reactions, and that's why you feel this way. And from that, kind of that thought process, it's not really a paradigm, but a thought process, then that's kind of expanded out to rheumatologists, because rheumatologists are the ones who deal with fibromyalgia patients.
They're the ones that you're sent to.
Yeah, so your GP sees you, they don't know what to do. I mean,
but it's
GP,
not a rheumatological problem. That could be
exactly.
A little frustrating.
Right, exactly. So your GP probably gets glassy-eyed when you talk to them, I'm sure, because you have 27 chief complaint lists and your GP has 5 minutes with you or 10 minutes, and they got to get out of the room. And there's no way they can really address all that. So they have to refer you to somebody who specializes in this. So they refer you to a rheumatologist. And there's a great article online. If you search John Lutkemeier, it's Lutkmeyer, I believe. He's out of Pensacola, Florida when he wrote it. It was like in 2006, and he's a rheumatologist, and he talks about how most rheumatologists do not want to treat fibromyalgia patients. He even said that fibromyalgia as a condition by itself is a deterrent for medical students potentially going into rheumatology, because they don't know what to do with you.
Didn't know that.
They don't know what to do with you. They don't have a great solution in terms of medications. They think a lot of it is psychological. And they say, well, why don't you go see the pain management specialist, who even somewhat denigrates in his article, saying, you know, they're basically just milking the system. So that's where you're left as the fibromyalgia patient. You're left, there's no main specialist that really wants to treat you. Now, I'm not saying that there aren't rheumatologists out there who don't treat fibromyalgia and enjoy that. But for the most part, fibromyalgia could make upwards of 30% of a rheumatology practice. I mean, it's that common. But a lot of rheumatologists don't want to see you because they want to see the conditions like rheumatoid arthritis, lupus, Sjogren's syndrome.
Something much more definitive.
Something much more definitive.
They have an ICD-9 code for. They have a specific, here's the medication for that. Okay, I'll see you in 6 months.
And they have these new fancy medications for those conditions. So I think it helps the rheumatologist to feel really good about what they're doing. And then they have the fibro sufferer. You have 27 chief complaints, and they don't know what to do with it.
And I'll emphasize, as you're about to find out in a couple of minutes, it's really more a neurological problem. So on top of everything else, it's like you're in the wrong place. And so they're very frustrated. So it's not that they're frustrated with you or that they hate you or they don't like you. Even when they say stupid things like, well, you should pull up your bootstraps, they're frustrated. So they just need to learn to say, I don't know what's wrong with you. I think that would at least make the fibro suffer. I know it would have made me feel a lot better. You know, makes you feel like you do start questioning yourself. Going, I know. You start thinking, am I crazy, or am I not really feeling all this stuff? So that's the problem with getting treatment. You are being sent to a rheumatologist for a neurological disorder, and you're being sent to somebody who just really doesn't know what to do for you and really doesn't want to see you. So this kind of leads into the history of fibromyalgia in and of itself. And I think Interestingly enough, we're sitting here in Reno, Nevada, about 35 minutes from where Epstein Bar Virus was
linked to chronic fatigue.
Linked to chronic fatigue, which, as most of you as fibromyalgia sufferers know, you're fatigued. And in the end, there's a number of links going on there. And we may talk about that in a few minutes when we talk about one of the main components. So I think understanding the history of it is, for a presentation like this, is critical, and I do think it adds to the fibromyalgia sufferer's ability to maybe understand what's going on and maybe calm down some of your stress responses. So history of fibromyalgia is, well, you go ahead. It's very interesting to me. When I was treating people with musculoskeletal disorders and they came with fibromyalgia, those were cases that didn't get better. And I didn't understand why. And that was right about the time in the 80s and 90s that fibromyalgia was developing. So history of fibromyalgia.
The history of fibromyalgia is that it actually goes back to the 19th century or the 1800s, where people were talking about pain similar to what you are experiencing. In the 1970s, it gained greater notoriety. Moving into the 1980s, prompted the American College of Rheumatology to really start looking at this condition. And they basically saw this subset of patients who didn't have rheumatoid arthritis, they didn't have lupus, but they had this exquisite pain in many different parts of their body, and they may have associated symptoms of brain fog, irritable bowel syndrome, depression. So they came up with the trigger point exam. So basically you use 4 kilograms of pressure. There are basically 18 points throughout the body that the physician pushes on, and if the individual is tender at least 11 or 12 of those trigger points, then they have a diagnosis of fibromyalgia, as long as they didn't have another condition and then they had some other associated symptoms. That was the diagnostic classification. Now, of course, in medicine, anytime you have a clinical diagnosis and there's not a definitive lab test, like a blood sugar marker or an MRI finding, a lot of physicians are going to be skeptical. So that skepticism really was highly present, even to today, sadly. But that skepticism persisted through 2010. And during that time frame, a lot of physicians felt that the pharmaceutical industry was almost trying to capitalize, and other practitioners were trying to capitalize on fibromyalgia patients, saying, you know, is this really a disease, or is this a non-disease? Or are we just marketing to these people, you know, to help them? So that's written in the rheumatology textbooks, just so you know. So that's not me going out on a wing there. That is what is written. So there's a lot of controversy, obviously, on many levels about this condition. So that fast forwards to 2010, because one of the problems that a lot of doctors were having with this, let's say you have a patient who has 10 out of 18 trigger points. So do you not diagnose them, or do you diagnose them with fibromyalgia? Or are these trigger points there because, as you know, having done a lot of chronic pain work in the musculoskeletal world, do they maybe have flat feet that are causing, you know, their calf muscles to be tender and their gluteal muscles to be tender, their knees, and they have some cervical spine dysfunction and a curvature in their neck, and that can create a clinical picture where somebody would be very tender in a lot of those places. And specifically when you press, the patient has to say, I'm having pain, not just that it's tender. So that prompted the new criteria developed by the American College of Rheumatology. It's called the 2010 American College of Rheumatology criteria for fibromyalgia. It's more based on, are you having pain in many different parts of your body? Kind of divide the body into 4 quadrants. Are you having pain in all these areas of the body? Is it severe? And then are you having associated severe symptoms of brain fog, depression, low energy? Are there components of irritable bowel syndrome? All those things. And there's a scoring system. If the person matches the scoring system, then you can diagnose them as having fibromyalgia. We also know now, though, too, that fibromyalgia can be associated with rheumatoid arthritis or lupus.
Right.
So just because you have fibromyalgia, or just because you have rheumatoid arthritis, doesn't mean that you won't necessarily have fibromyalgia. So that's a very interesting distinction as well. But that's kind of the history leading up to now.
And in the end, I think for me, that takeaway point, and I've been in practice since 1979, I've been in this kind of healthcare field since like about 75, 74, around there. And I was in it before there was a lot of testing. And so when I was younger and learning how to diagnose, if Dr. Gates is going to talk about something called Hashimoto's thyroiditis, if somebody had 20 out of 20 symptoms of Hashimoto's thyroiditis when I was a kid, and we knew to treat it, we would treat it even if the test was normal. That was considered good doctoring. That was considered being an astute clinician, because we didn't have MRIs, we didn't have CAT scans, we understood that blood testing was kind of a little bit all over the place. But the takeaway point to me here is doctors today are hesitant to do anything if there's not a specific test that confirms the diagnosis. And that goes about 100 times for fibromyalgia, because not only is there not a specific fibromyalgia test, and I'll go one further on the pressure points. I know when I was feeling that sensitivity all over my body, you could have hit me in 1,000 places, and I would have been sensitive in all those places. But there are multiple moving parts to this that we're about to discuss that is never going to lend themselves to a test for fibromyalgia, and this is a problem. This is a problem, and I think it's going to continue to be a problem because, as you told me before we started this, those 2010 diagnoses are still the way that people look at diagnosing fibromyalgia in the medical model, which is a big reason why you're still having a lot of problems getting somebody to help you understand what's going on. So let's help you to understand what's going on here. There are maybe 6 moving parts that we see consistently in the fibromyalgia patient. And we're going to go through them kind of in the order of I think, importance as to there's like a hierarchy as to how your fibromyalgia develops. And it's not exactly the same in everybody, but these moving parts are going to be there to some degree, in some gradient, in pretty much all of you. So let's first talk about the contribution of the brain to fibromyalgia and specifics of what that means.
Yeah. And that ties into with what we were talking about earlier relative to childhood abuse being so important for this. So
stunningly.
It is stunningly. So the research statistics strongly associate childhood trauma with fibromyalgia. Childhood trauma is also associated with irritable bowel syndrome, depression, and anxiety later in life. The reason why that researchers think is that you have a fear center in your brain, and that fear center is meant to be shut off like a brake pedal from the frontal lobes as well as the memory area.
And we alluded to that in the consultation.
Exactly.
That mechanism that we went through just a few minutes ago.
And so when a child is developing, their frontal lobes are not myelinated yet, and so that fear center doesn't get dampened. So now your basal levels, so think of your resting levels of stress responses, may be 30% higher than somebody who was not exposed to trauma. And not all of you have been exposed to trauma, but a significant percentage. So in other words,
their brain isn't mature enough at that age to shut that mechanism down.
So now that mechanism gets strong, and it stays strong for the rest of the individual's life. And the research basically varies. So they've looked at it, and some fibromyalgia patients are going to have really high levels of like adrenaline and cortisol. Through time, though, we've seen where people can kind of burn out, so to speak, where their adrenal glands just can no longer make high levels of cortisol. But it's now being shown that the adrenaline can still stay high. Bottom line is these stress hormones can make people more sensitive to pain. And these stress hormones have a vast array of effects, from damaging the gastrointestinal barrier, which we'll talk about later, to negatively affecting frontal lobe function. And remember, your frontal lobe is your brake for the fear response. So that can be further perpetuating the physiology really of depression, anxiety, and insomnia. So that's the first component. The next component of the brain is that you have to understand that it's not pain until it gets to your brain. There is a distinction, and you don't really need to understand it too much, but just know that we all have pain nerve fibers sending signals into our spinal cord, into our brainstem, but actually only 25% of those signals actually get to the brain for us to realize that it's painful. And a good analogy for this is For a normal individual, a hug is not painful, but for a fibromyalgia patient, lots of times a hug is painful, or the shirt on someone's back can be really irritating. That's because this background level of pain is so much amplified. And they've done studies where they put like an electrode on a hand of someone with fibromyalgia versus someone without fibromyalgia. And when they put the electrode on someone without fibromyalgia, they can go and look at their brain on the opposite side and see that the brain lights up perfectly how they would expect it to. But then in a fibromyalgia patient, not only does that part of the brain light up, but their emotional area lights up as well. So
back to the childhood trauma.
Yeah, and so sensory stimulation almost becomes an emotional event. And that's very, very important for you to understand. So this is well acknowledged. This is all
right. None of this is
out
theory.
of the literature.
None of this is
We can show
theory.
you the vast array of articles,
right?
I mean, hundreds of articles that are going
Literally.
into making this broadcast and years of research. So that's another big component of the brain. The other component is the brainstem not filtering out pain. So there's some thought that when people have insomnia, their lower brainstem doesn't work as well. And so your lower brainstem makes chemicals like serotonin, like morphine. Morphine actually comes from the upper brainstem, but you get the point. The brainstem makes these chemicals that actually drift down your spinal cord to shut off pain. And when you're not sleeping, you don't make those chemicals in the right values, and then that also predisposes you to pain. So right there you can see how there's a strong neurological origin for a lot of your pain and suffering, but it goes much deeper.
And the pain, and just to kind of recant, the pain that we as fibromyalgia patients experience is at least partially caused by the stress hormones affecting the nerve endings, the pain fiber nerve endings throughout the body.
Yeah, it's thought that at the dorsal root ganglia, it's in your spinal cord, right as the nerves come into your spinal cord, that there can be receptors there. And they've done studies where high levels of cortisol can make people more sensitive to pain, which was a paradox for a lot of researchers, because what do we do for somebody who's having a lot of pain? We give them cortisone, right? Which is a cortisol derivative, or prednisone. But when cortisol is high chronically, that's where it can cause pain receptors to become more sensitive.
So in the end, the pain for the fibromyalgia sufferer really is kind of in the head.
Yeah, so it's in your head, but it's not in your head like psychologically.
Right, and so that's presented first because the brain is the key. What we have found here in our approach to fibromyalgia is if that fight-flight mechanism that Dr. Gates described is not dampened, if it's not calmed down, if it's not brought under control, it is virtually impossible to help resolve the pain of the fibromyalgia patient. And if the pain is resolved, but that is not gotten under control, long-term responses are virtually not going to happen. So this is why Dr. Gates presents the brain first, because going back to the fact where I stated it's not a rheumatological problem, this is why your rheumatologist is frustrated. This is not what your rheumatologist does, okay? So you're going to the wrong person, because that's where you've been told to go because you have joint pain. And so this is one of the big dilemmas for the fibromyalgia patient. Now, peripheral neuropathy, again, as a fibromyalgia sufferer, as Dr. Gates found out the day that we met and he examined me, he found out that I had peripheral neuropathy. And this has been an amazing development in the understanding of what's causing the pain in the fibromyalgia patient. And for us, this is like extremely exciting. At least for me, it's extremely exciting because this is a huge key to not only understanding your pain, but being able to ultimately address it.
Yeah. So we've seen a lot of fibromyalgia patients, and prior to 2013, I would be doing examinations on them. And as a board-certified chiropractic neurologist, I'm looking to see, okay, does somebody have spinal cord disease? Do they have peripheral neuropathy? I'm always checking that. And I kept seeing signs of this condition called small fiber peripheral neuropathy in our fibromyalgia sufferers. And I would just scratch my head because I would think, well, they can't have that. So it just must be something else. And then ultimately, I was vacillating on it. And then ultimately in June of 2013, I saw an early publication of an article basically saying exactly what we were seeing. And they demonstrated that small fiber peripheral neuropathy was present, I think, in 41% of these fibromyalgia patients. And this was the journal Pain. It later came out, I think, in November of that year, 2013. So for you to understand what small fiber peripheral neuropathy is highly, highly, highly important. So think of your brain, your spinal cord. You have nerves that come out into your extremities, your arms, your legs, down into your feet. Those nerves are just like wires. And those nerves kind of have insulation around them for the most part. Now, there are different types of nerves. You have big nerves, like within your sciatic nerve, that encode things like your toes moving up and down, or feeling vibration on your toes, or helping with balance. And then we have little nerves that sense pain and temperature. And what they found is that these little nerves that sense pain and temperature, and a lot of them don't have any insulation around them, are dying and degenerating in fibromyalgia patients.
And this is the patient who's feeling what?
This is a patient who's feeling
numbness, tingling.
They may feel tingling. You may just have pain all over your body too that nobody can figure out.
Okay.
And so this was like the holy grail of findings, in my opinion, for fibromyalgia patients, because so many of you have said for years, there's something wrong in my muscles. There's something wrong. I know there's something wrong, and everybody's telling you there's nothing wrong. Well, now we can definitively say there is something wrong for a huge percentage of you. At least half is the current consensus of fibromyalgia patients, and it goes even further. So another study came out, I think it was in 2014, Annals of Neurology, where they do this thing called microneurography, which is where they can look at your pain receptors and how they're functioning. And with this technique, they found that 76% of fibromyalgia patients have abnormal pain receptor nerve fiber functioning, even independent of the small fiber neuropathy. So their pain nerves and their receptors are just abnormal. That's 76%. That's 3/4 of you now, where we have a peripheral, we have like a tissue lesion, but it's actually a neurological lesion out in your extremities that's causing a lot of your pain. So this is highly, highly exciting. We've been trying to get this out there because many of you need to know there are things wrong with you, and this is one of the biggest features. Other studies on small fiber neuropathy, it goes even farther, where they're doing electron microscope readings. So do you think most people know what an electron microscope is?
No.
Okay. So we have the standard eye microscope, which is where we can see things many thousand times smaller than the naked eye. But then we have the electron microscope, which can go to like 100,000 times smaller. And they've actually compared fibromyalgia patients with small fiber neuropathy compared to patients with small fiber neuropathy who don't have fibromyalgia. And the fibromyalgia patients, their small fiber neuropathy is way worse. Their nerve fibers can be like 10 times smaller than even the small fiber neuropathy patient. So again, there's just more and more credence as to what is wrong with you. And in JAMA Neurology, JAMA is Journal of the American Medical Association. They have a neurology paper that comes out. And last year, in 2016, they did a pivotal study showing that small fiber neuropathy can be throughout the entire body. And so, just another little tangent. For those of you who Google peripheral neuropathy, you're going to see diabetes, you're going to see people with nerve damage down below the knees that may spread up to the hands. Now this is an important point, because what they've now found with small fiber neuropathy is it tends to not be that way. It tends to be non-length dependent. And so it can be throughout the entire body that you're losing these small fiber nerves. And really when these small fiber nerves start to go, they fire off too much. So they create pain in the process of them dying. Kind of think of somebody flailing while they're drowning. That's kind of what your nerve fibers are doing.
So now, if you're freaking out right now, okay, okay,
and we're not laughing.
Yeah,
at you,
we don't mean to laugh. But I mean, there are solutions for all this, but to bring it more into kind of like the lay world of, listen, I got a problem, what's going on? Usually once we've been able to walk through an examination and the patient is able to see hardcore data in their own body of these things going on and understand that there is solutions for these, which we're going to talk about later. I've seen a lot of people start feeling better before they even walk out the door, because just knowing, okay, this makes sense. there's something that can be done for it. In the back of your head, your brain is whether you realize it or not, is going, where is this going? Is it ever going to end? What's my relationships going to look like? Am I going to be on disability? So on and so forth. And a lot of that can go away. We're going to be, and you're starting to get a feel for something we're going to cover a little bit later, which is why the medical model, and frankly, much of the alternative model today doesn't have an answer for this, because you're beginning probably to understand why there's no one diet for this. There's no silver bullet for this. There's no one pill for this. B vitamins aren't going to take care of your pain. And so there's a couple of more important parts, but as a fibromyalgia patient myself, I was just starting to sense a little bit of despair listening to you.
Okay.
And going like, but I know that everything's okay. So let's just take a 2-second break there, let everybody know everything's okay, and get on to another. Do you want to do gluten first?
And maybe,
or do you want to go ahead?
Yeah, just know that there's new data coming out on peripheral neuropathy. We're almost done with our book, where we talk about there are new solutions for peripheral neuropathy. A lot of people will talk to their doctors and say, there's nothing you can do for peripheral neuropathy except taking medications.
Yeah.
And we're actually finding now there are new studies showing you can regenerate nerve fibers, you can get more blood flow to nerve fibers, but you have to calm down the underlying attacking factor to the nerves, which for most of you is your immune system.
Right.
That's what they're finding. Okay.
So thyroid next or gluten next?
Let's go with thyroid. Thyroid is another great component of the fibromyalgia sufferer's existence. So relative to the thyroid, so many of you have your thyroid tested, and you have your thyroid test come back and you're told that you're normal. Most of the time, based on our experience, and we've evaluated thousands of chronic pain patients, when people come in, they've had hormone tests for their thyroid. So meaning they've had a test for a hormone that comes from your brain telling your thyroid to work, and a hormone from the thyroid that's inactive most of the time. And lots of times those tests are normal. But there was a lot of observation in how fibromyalgia patients and other patients could have immune cells killing their thyroid, and their thyroid tests wouldn't necessarily be abnormal. And the literature has just expanded and expanded and expanded and shown that these immune cells to the thyroid don't just kill the thyroid. They actually go in and they can kill brain tissue, they can affect frontal lobe function, they can affect blood flow to the frontal lobes. They can kill your cerebellum, which is your balance center. And a brand new study just came out. The first big study was clinical rheumatology in 2014, where they really said, okay, there is an association here. A lot of fibromyalgia patients have autoimmune thyroid disease. And if you look up euthyroid Hashimoto's thyroiditis, you Google that and look at the symptoms, a lot of the symptoms are going to be similar to what you're experiencing. And so
because most of you have it.
Right. And then a new study came out just this year, 2017, I think February 9th, and it's attached to our broadcast we did this week. But it was very exciting because they said 62% of Hashimoto's patients, who euthyroid Hashimoto's thyroiditis patients, have fibromyalgia. Now that's a really big statement in the literature. And it gets even bigger because there are varying degrees of how you quantify or how you say this is Hashimoto's or this is not Hashimoto's. And basically researchers have to use a certain number of immune cells to the thyroid as their parameters for saying you have Hashimoto's or you don't. Just like if you have a blood sugar over 100, you're pre-diabetic, over 125, you're diabetic. Now, this marker for what constitutes Hashimoto's has been coming down through the years. LabCorp, for example, still says anything over 34 is too high. If you're below 34, you're normal. Yet the Mayo Clinic says anything over 9 is too high. Our local hospital here says anything over 9 is too high. We have another hospital here that says anything over 8.9 is too high.
So a lot of people who have Hashimoto's are being told they don't have it.
Right, so if you have this immune count to the thyroid is called a thyroid peroxidase antibody, and you're at 11 or 10 to 34, and you have a test through LabCorp, you may think that your tests are normal, when in actuality it's the same unit of measurement, but different research centers, different facilities are saying different things. And this Hashimoto's phenomena is hugely important because we see it in the majority of our fibromyalgia patients where their immune system is killing their thyroid. It has a number of other effects. Mainly the effects are affecting frontal lobe function, so like brain fog, affecting balance, affecting your cognitive clarity, fatigue, all these things can be wrapped up into this. And the underlying causes for your immune system spiraling out of control and attacking your thyroid can be food reactions in the intestines. Stress levels are thought to maybe affect it, as well as now the definitive thing are viruses living in the thyroid.
So Epstein Bar Virus.
Epstein Bar Virus.
I referred to in the beginning where I said a gentleman who discovered that connection lives 30 minutes from here. And they test you for thyroid because you're fatigued. So they just test you for the thyroid hormone.
But they check you for the thyroid hormones. They don't check you for the immune count to the thyroid most of the time. And if you do even get that check, you have to really look at the parameters on what they're saying is normal and abnormal. And for the thyroid peroxidase antibody, I'm just saying anything over 9, our local hospitals say is too high. In the Mayo Clinic, according to the last time we looked, they were saying was too high.
Yeah.
So that's significant.
And it even goes more than that in a sense that once you get an immune attack on one, like say on your thyroid, you start to get immune attacks on other things. You talked about the cerebellum. You can get an immune attack on that. Now you have dizziness, vertigo, imbalance. You can get an attack on your B vitamins. Now you got chronic anemia, chronic B12 deficiency, and you're taking B12 shots and it's not working. For younger women, it seems to be connected to polycystic ovarian syndrome. There seems to be a big connection to celiac. Okay, so there's more. There's a connection to Meniere's disease. I got dizziness, I got ringing in the ears, and now I've got vertigo. I'm sorry, and now I've lost my hearing, and so it creates that. So I'm just trying to communicate that the fibromyalgia patient who has all this stuff, and you've been to the audiologist and they told you it's okay, and you have vertigo and you can't stand up, and you went and got an MRI and a CAT scan, and you've been told it's okay. And you went and you got a blood test, and they told you that you didn't have celiac because it's really a stinky blood test to begin with. These are so many of the confusions that we as fibromyalgia patients deal with, okay? And so this is where the no BS is coming in. As you'll notice, Dr. Gates continues to cite references in peer-reviewed journals in some of the most prestigious peer-reviewed medical journals in the world, the most highly considered, and so that this data is all very solid, and it starts to give you a real concept of why, again, there's no one blood test. You have to understand the basic moving parts of fibromyalgia in the first place. And there's more. Let's go over the now at least somewhat relatively better, well accepted gluten protein.
So gluten, some of the researchers started looking at, and many of you have probably tried a gluten-free diet, but the researchers started saying, well, now there's this thing called non-celiac gluten sensitivity. So I'm sure most of you have heard this. So if you are out dining and you're eating something gluten-free, someone will say to you, well, unless you have celiac disease, you can eat gluten. Because celiac disease is an autoimmune reaction in the gut to gluten. It's far more prevalent than it used to be. It used to be 1 in 1,000, now it's 1 in 100. And that can cause not only consequences for the gastrointestinal tract, it's been shown in the literature to cause problems with peripheral neuropathy, depression, can cause a host of issues.
A lot of the things that fibromyalgia
patients have. So then there was this explosion of information on gluten. So a lot of people started going gluten-free. Their tests were negative for celiac disease, but they felt significantly better being gluten-free. And then if they ate gluten again, they felt like crap. And so that prompted this diagnostic criteria called non-celiac gluten sensitivity. It's highly debated, but you can go back and watch our broadcast on it. It's interesting. The one major thing they've seen with gluten sensitivity was that it causes depression. And a lot of you suffer with depression. And so it may not necessarily just cause, there's some research saying yes, it causes GI consequences even when you don't have celiac. There's more research saying you can have depression. There's a lot of research now saying if you have peripheral neuropathy and you don't have diabetes, like 1/3 of the time it's due to a gluten reaction. If you have problems with balance severely and you're veering down the hallway, you might have gluten ataxia. More and more information is coming out, but they started looking at the symptoms of non-celiac gluten sensitivity, which can be anything from headaches to brain fog to neuropathy to depression. And they said, well, let's do a study with fibromyalgia patients. So this came out in Rheumatology International, I believe in, was it 2014? I think 2014 or 2015. They took 20 fibromyalgia patients and okay, let's put them on a gluten-free diet. They put them on a gluten-free diet, and within 8 months, all of them had significant improvement. Either they were off their medications or they were back to work. All the parameters that the researchers were studying were significantly improved. So there is a link between gluten and fibromyalgia, but what we're trying to convey here is that fibromyalgia is a complicated multifactorial illness, and it's not just one thing. So gluten is a piece of the puzzle. Really, it's just the tip of the iceberg, because next we're going to talk about irritable bowel syndrome, which we see so often in fibromyalgia patients, and the food reactions get ever so more complicated with that.
And again, back to the nervous system. I mean, our point, the main point is this is a brain and nervous system problem. We talked about stress hormones. We talked about fight-flight hormones that are caused by the brain. We talked about childhood trauma. We talked about peripheral neuropathy, which is damage to the smaller fibers in your feet and throughout your body, we now know. We know Hashimoto's thyroiditis can also affect brain function. It can also affect your cerebellum. It can also negatively affect your frontal lobe and contribute to depression. And it can also actually create inflammation that damages the nerve endings of your pain nerve endings. Gluten, what Dr. Gates is saying, you know, for those of us who are a little bit less inclined towards some of the academics of this, is if you eat gluten and it doesn't affect your gut, it's probably affecting your nervous system.
That's a good way.
It's probably affecting your brain fog, depression, short-term memory loss, which is what we see, even beyond what the literature says, or the nerve endings in your feet. And last but not least,
irritable bowel syndrome.
Irritable bowel syndrome.
Which we see in a huge proportion of fibromyalgia sufferers. It's commonly acknowledged. IBS, you may have constipation, you may have diarrhea, you may have both, you may have cramping, bloating, distension, lots of times down in your left lower quadrant. And you eat foods and you have a hard time understanding which foods are causing it. You're probably thinking, well, is it spicy foods? Is it alcohol? Is it greasy? There can be a host of reactions. And the problem that happens with IBS is that there are local changes in your intestines. So the bacterial makeup of your intestines changes when you have IBS. Think of you as having bad gangster bacteria in your intestines. And these bad bacteria like to metabolize certain foods. And so they may metabolize healthy foods, seemingly healthy like broccoli, or they may metabolize things like apples and cause a lot of gas. But the problem for a lot of you is that you don't know where to start in eliminating all these foods, because you may want to get off gluten and you may be trying to get it off dairy because somebody told you to do that. And now you're trying to restrict all these IBS foods that can cause excessive gas. And that's not to say maybe you have small intestinal bacterial overgrowth, which is a new feature that's been associated with IBS, where you can get too many bacteria in your intestines. And a lot of people may go on these diets, they use probiotics, they may have a marginal improvement, but the main thing with irritable bowel syndrome goes back to the brain. There was a great article that came out, I think it was last year, where they wanted to rephrase the name irritable bowel syndrome to irritable brain syndrome, because the vast majority of IBS sufferers have depression, anxiety, other neurological problems. And what they find is that their emotional center in their brain gets overactivated. That emotional center in your brain has direct connections to your gut through something called the autonomic nervous system. And that's really the underlying driving factor for why motility is off in the intestines. And then that is why the bacteria get shifted. Maybe you get too many bacteria because you have like little, think of going through the Panama Canal, how the ship goes through and then they fill up the little canal with water and they go to the next one. Your gut works the same way. But think if you're going through the Panama Canal and all of a sudden the wall behind you is opened up. So now the water is going back the other way. That's a problem. That can happen with this small intestinal bacterial overgrowth phenomena. So now you start getting bacteria creeping up the wrong direction and you have horrible bloating, distension, nobody can figure it out. So IBS is certainly a feature of this. We work with this all the time until you get the individual's food allergies figured out, until you get every last food bacterial reaction figured out, and until you get this stress response calmed down. In our experience, you don't have a hope to really help an individual long term with these issues.
Yeah, and you don't have a hope to come up with the real specific diet for that person to create that long-term response. Because, and again, maybe the No BS series, maybe BS is a little strong, but what we're trying to do is tease out all the confusion that most of us have gone through at some point in time. So now everybody's all over diet. Because diet's easy. Diet's easy to commercialize. It's the paleo diet. It's the SIBO diet. It's the FODMAP diet. Everybody and their grandmother.
The histamine diet.
The histamine diet, and on and on and on. But as you're beginning to see, there are multiple moving parts to the gut itself. When people ask me, well, what is the best diet? And the answer is this. There is no best diet. There's your diet. Well, how do you figure that out? Well, here's how you figure it out. You calm down the fight-flight response in the brain that Dr. Gates just described, and what I just described a little bit earlier in that consultation. And if you don't calm that down, your gut is lacking blood supply, because when you're fighting or fleeing, you don't need to be peeing or pooping, so it takes blood away from there, okay? The vagus nerve that goes to your gut starts not working, and then all of the internal things that Dr. Gates just talked about start happening because of stress hormones that are damaging the inside of your gut. Until you do that, any diet you do is going to be temporary. It's going to even gluten. I had someone in here the other day, it's no question, they're sensitive to gluten. They said, I got off of gluten and nothing happened. It's because she was in post-traumatic stress syndrome. It's because she had a lot of bad bacteria. It's because a lot of these things were already there. So you first have to figure out calm the brain down, what's going on in the gut. Is there small intestinal bacterial overgrowth? If there is, it has to go, preferably without drugs. And then you get rid of that. Now you can fix that leaky gut with herbs and botanicals. At the same time, what Dr. Gates does is he has the patient on an allergy elimination diet, which has the added benefit of calming down inflammation and calming down immune responses. But he does that because that's the most accurate way to find out what your food sensitivities are. Well, you can't even find out what your food sensitivities are when you are undergoing all of those processes, even on an allergy elimination diet. Mm-hmm. But once you dampen everything down, get rid of what's in there, heal the gut, and now you start reintroducing foods, you start finding out what your food sensitivities are. That's how you figure out what your diet is. And I just emphasize that to say, again, each piece should add to your understanding of the complexities of this. And then there's the complexity of each piece in and of itself. And then you start to realize again, we have lots of people who've come here from very qualified functional medicine practitioners, dietitians, nutritionists, but the diet didn't work. The bags of supplements didn't work. These things didn't work, and they didn't work because the key factor is this fibromyalgia is a primarily #1 neurological problem. And until that is handled, nothing else is going to work long term. You might get some bits and pieces that might help one symptom here, one symptom there. But the process is going to continue on in general.
Right. Yeah. And just one more piece on that food allergy thing, as you're saying, until every last food allergy is figured out, you also have to know how to discern, is it a bacterial reaction? Is it an actual food allergy reaction? It gets nuanced. But what you just said, I think, leads into our final point.
I was just going to say that.
On many of you are interested in these topics that we're talking about, and you have to understand there are different paradigms for addressing all of this. There's the medical paradigm, there's the integrated alternative paradigm, and then there's really this paradigm that we're talking about. Truly, our paradigm is functional medicine and functional neurology, but unfortunately there are a lot of people out there doing functional medicine, or they're saying what they're doing is functional medicine, but it's more alternative medicine. And let me explain that in more detail. So as you as the fibromyalgia sufferer, most of you know this. You go to your medical doctor, your GP, you get referred to a rheumatologist. You may end up on Cymbalta, Lyrica, gabapentin. Some of you end up on morphine derivatives to manage your pain. Told to go to counseling, told to see a psychotherapist, told to exercise, even though most of you have great difficulty in exercising, but you're told to exercise.
Because they need to lose weight.
Yeah, that's kind of the treatment approach that most of you are exposed to. And there can be variations, absolutely. But those are the commonalities that we hear of. And then you can go and see the alternative or integrated healthcare practitioner. So you go and see them, and they're going to look at your hormones, and they're going to use bioidentical
The medical
hormones.
integrated
The medical integrated practitioner. Right. And they're going to give you some supplements because, curcumin decreases inflammation, and your estrogen is high, so we're going to use diethylmethane. They're going to use certain herbs and botanicals, but really they're almost treating your symptoms, again, either with a medication or a supplement. It's a supplement or a medication for a symptom. That's kind of the model that they have. And we're not knocking it, but that's just what you're going to get exposed to, because a lot of people ask us, well, can I just take curcumin for this? And hopefully you can understand, after we've talked about this at length and the complexities involved, taking curcumin, in our experience, is just not powerful enough for most people to get rid of these
And it's
issues.
because that's promoted as this is all inflammation, and curcumin gets inflammation. Well, basically, what's causing the inflammation? Pretty much everything we've talked about since we sat in this room.
Exactly. And then there's the functional medicine and functional neurology approach. And that's where you have to address these big factors. Like we said, think of them as big dominoes. Your biggest dominoes are literally the stress response that we've talked about, the effects of trauma from childhood, and peripheral neuropathy, or nociceptive dysfunction, as it's termed, or C fiber dysfunction. Pain nerve dysfunction, think of it that way. You have to address those big pieces, because until you address those, then you can give someone a bag full or 2 bags of supplements that they'd have to keep taking their whole life to patch all these holes that are in the ship, so to speak, if it even helps. And once you start addressing these main factors, then you can go in and start to address these other factors that we've talked about, from the gastrointestinal tract to the underlying factors associated with the thyroid. And this approach we have found to be by far the most productive in our clinic, time after time after time. And the research really is overwhelming in terms of what is wrong with a fibromyalgia patient, and that's how you need to attack it, not by giving somebody curcumin.
And when you say that, let me just make it clear. We make it clear to our patients when they come in here, we're not going to cure them. Okay, right. That's a big question that comes out over and over and over again. A lot of times I'll have, and this is just the way it is, okay, so don't take this as sexist or anything. A lot of times I'll have a female patient sitting there with the husband who's got his arms like this, and I'll go, well, are you going to cure my wife? And I'll say, no, and all of a sudden he'll relax, because there have been many people who told that person they were going to be cured. And the reason that they're not going to be cured, Dr. Gates at one point said the vast majority of our patients have Hashimotos, who came in here with fibromyalgia, Hashimoto's thyroid. I actually don't ever remember somebody coming in here with fibromyalgia who didn't have Hashimoto's. I'm willing to concede there might have been a couple. Okay, but the point is that you're going to have an autoimmune problem, and the key to you getting better is to dampen that immune response. But again, as Dr. Gates just summarized, this is a systematic problem, and the system and you have 9 systems in your body, and the king of systems is your brain. Your brain controls everything, and apparently your brain perceives everything. So the brain goes first, and then maybe the next thing that goes is the immune system, and then maybe the next thing that goes is the gut, or maybe the next thing that goes is the gut, and then the next thing that goes is the immune system, and it's off to the races. So that is that's the reason that you're going to have the types of responses that you have when you're trying all these different things, because the systems approach that Dr. Gates is describing has proven to be consistently successful. But it's successful in substantially improving people's physiology, stopping the downward progress, reversing the downward progress. In most cases, substantially improving the physiology. I mean, I would put myself at 90% better, okay? And then allowing you to have the tools to be able to control your immune responses and your stress responses throughout life, so that you can maintain that, preferably on your own, because this is a big lifestyle change. Huge. It's not just diet.
Right.
It's lifestyle change. It's a social lifestyle change. It's a lifestyle change of where is my level of exercise, because too much exercise can set you off. So, so it's a multi-systems problem, and it demands a multi-systems approach.
Yes.
And it's not something that can be cured. Another thing I think that you might want to go into is why, and I kind of led into that a teeny bit, is why people come in here with bags of supplements. People come in here and they're going to the gym because they got to lose weight. You're not losing weight because your thyroid stinks, because your blood sugar is off, because your stress hormones are sabotaging you, because your gut's bad and it's doing a number of things there. It's not about going to the gym, but they're telling you to go to the gym and you think more is better and all this type of stuff. You think more supplements are better. Apparently people think more drugs are better, because when I do the interviews, people on fibromyalgia take lots of drugs. What is our mantra?
Less is more.
Less is more, which usually is music to the ears of the suffering fibro patient.
Yeah. Yeah, the idea is not for you to be taking a gazillion supplements. The idea is to use specific supplements, or if somebody needs to be referred for medication, for those to be addressed in an organized, systematic fashion, because you have to heal the big players first. You got to get the brain and the nervous system under control, and you have to then heal the gut. And then from there, you can go out and start looking at other factors associated with that person's illness. Lots of times you fix the big dominoes, the other dominoes go down. Now, sometimes patients will take 5 supplements, 7 supplements during an intensive period of our treatment, but
Right.
the end goal is for them to be on maybe 1 or 2 supplements by the time they're done with our treatment program. That's the reality of it.
And I know that's
what we strive
unbelievable to you, but to go back to that description that we talked about when we were in my office and I was doing kind of a consult to you. I can't. So many people come in here and they're taking Bragg's apple cider vinegar or hydrochloric acid, or they're taking pancreatic enzymes, or they're taking bile salts for their gallbladder, and of course they're taking the ever-present probiotics for the rest of their life, because everybody needs good bacteria in there. But if you calm that stress mechanism down, which screws up all of those things, if you get the immune attack against the thyroid under control, which calms all of those things, all of a sudden a lot of things start working in your gut. You start making hydrochloric acid again, your pancreas starts working, your gallbladder starts working, and you don't have bad bacteria. You don't have to take any of that stuff. And that is so hard for people to grasp, because a lot of fibromyalgia patients are so sick, they cannot possibly grasp that they could get to that point. And I'm to that point. And most of our patients get to that point. And different people can obtain different levels of improvement. Okay, I mean, some people are going to get 50% better. Most of our patients do substantially better than that. But there are patients who are very, very ill, and these methods only work as good as the tissues allow them to work, as much as the nervous system allows the strategies and the exercises and the protocols that Dr. Gates uses to calm down that fight-flight mechanism. You have to have, like, I've had multiple concussions, so there are certain parts there that aren't coming back. But there's a lot of stuff that did come back, or I wouldn't be sitting here talking to you. So this kind of feel like is like putting it together. There's the whole point is that the brain, the peripheral neuropathy, the thyroid, the fibro. If a person came in here with fibromyalgia, as we've had happen many times, and they're 100 pounds overweight and they can't lose the weight, and we find out that they have fibromyalgia and they have peripheral neuropathy and they have irritable bowel syndrome and they've had childhood trauma, we're going to be having the same conversation, because putting it all together means everything has to be addressed, and it has to be addressed in a specific order. And if it's addressed in a specific order, that's much more efficient. You don't have to treat all 100 things that seem to be wrong with you. You treat 2 or 3 major systems, and the rest resolves. So the weight person gets their fibromyalgia to go, and the fibromyalgia patient gets their weight problem to go, and everything else in between. For me, that's kind of putting it all together.
I'm with you. And I think hopefully now at this point you have a much better understanding of what's causing your condition, the potential factors that may be associated with your specific case. So we hope this was helpful, and I think we'll go on out and let them see what's next.
Okay.
So hopefully you found today's broadcast really helpful on fibromyalgia. We tried to illustrate to you why there's no one magic bullet for fibromyalgia. So many of you are seeing marketing ads for chelation, to parasite treatments, to taking turmeric, to taking this vitamin. And hopefully you can now understand with the complexity of this condition based on the current science, these are the things wrong with fibromyalgia sufferers. There are things wrong with you. It's not all in your head. We hope you have that understanding now. Now, if you're interested in getting your case evaluated to get further understanding on it, to see if you can be helped, then you can go to powerhealthconsult.com to see if you're a candidate for our program. All the information is there for you to fill out. We really appreciate you watching, and we hope to see you soon.